Hi, welcome to Fit Tech Videos. In this video, I want to take you through a slightly older child, and thanks to my son Joshua for volunteering to help us with this video. He's 9 years old, and this is pretty much the age that I start seeing clients. I do here and there do the younger ones. So in the previous videos, I had my little girl Jewel. She's 5, and you can start working with your kids at that age. But you'll see from the age of about 9, 10, that's when they really start needing it. Josh often complains of knees, and well, I say often, every so often, put it that way, complains of his knees, and then we know he's going through a little growth spurt. And then we just release it a little bit, and it makes a huge difference. So also at this age, they're starting to play a little bit more sport. They're starting to be a little bit more active. So it's good, but it's good to start at the younger age. But I'm going to show you with the 9-year-olds a bit older, you can go slightly more in depth with the releasing. It is still going to be very ticklish. It is tricky. Some kids are going to be way more ticklish than others, and I find especially if you're working with your own child, it's worse. I find kids come to me, then the parents sit there, I do the work, and the parents are quite surprised that I'm able to do what I'm able to do because they battle to touch them, and I tell them what to do, and they're like, yeah, but they're not going to let me. So the key is just to go slowly through it. So in this first video, we're going to take you through the lower half of the body. So we're going to work in the quads, very important area, because with boys and girls from about age of 9, 10 to about 15, a lot of ankle, foot, shin issue, a lot of knee issue, a lot of hip issue, and lower back. You can see Josh is already ticklish just touching him like that. So we're going to start with the quad, and I generally will stand on the same side of the body that I'm working, but for the video I'm going to lean across to show you so you can see what I'm doing more. Also I've opted to use the massage bed just for this video. Now, you don't need a massage bed to work on. You can work on the floor, you can work on your bed, on a couch, on whatever is comfortable for you. So I opted to show you on the video because I felt if it's easier for me with the adults partner assisted. I showed you on the floor because that's fine, because I want you to see how it's done on the floor. But with the kids, I feel I want to be more control to show you how to do this. So we're going to start with a quad. So a good way to do it is to basically lift the leg up, hold it in there. When I say in there, hold your hand into the fold of the knee and get it nice and relaxed. I find adding a bit of movement helps a lot. Now you want to go in and do the triggering. So obviously you can see just by doing this very, very light triggering, it's very ticklish. So sometimes you got to go a little bit more than light, but not too hard. So now I'm going to go a little bit. That's a bit better. Hey boy, it's ticklish, but it's a little bit better. So to combat the ticklishness, what you want to do is add a bit of movement and then a little bit of stimulation. Add a bit of movement, a little bit of stimulation. When you add a bit of movement and you stop the stimulation, the body's not so ticklish. So once you've done a little bit of warming up, a little bit of stimulation, and it is quite ticklish, and you got to go, every child's going to be slightly different. Then you can add a little bit of a press and a stretch. Press and a stretch. That's a little bit easier to handle. Hey boy, it's a little bit sensitive, but but sensitivity is good. It mustn't be sore. There's a big difference between being a bit sensitive and being sore. And in fact, he's happier for this than for this, right? You see, straight away, when you go too fast, too hard, they don't like it. So get the hand on the muscle and just stimulate. Add a bit of movement, stimulate, add a bit of movement, stimulate. And you obviously have to do a little. So it will be a little bit ticklish, but then you just stop. Then what you can do, so I'm going to put this leg down, I'm going to lift this one up. So generally I would do that on the side that I'm standing. Now I'm going to lift this one up as I would. So we've done that. Now I'm going to show you the adductor. So basically what you want to do is a little bit of internal rotation, or external rotation, excuse me. The foot's coming in, the hips turning out, and then you can work in there. So again, you can see that's quite ticklish. So a little bit and let go, a little bit and let go. He can handle a little bit at a time. He's going to move, but that's okay. And then add a bit of movement, a bit of rotation. Now what you're doing is you rotate externally, rotate out, foot comes in, grab hold of the muscle, rotate in and do one or two movements. Rotate in, 1 or 2. So you're going to do it quickly. In, there, not too sore. But this is very important because this adductor will work with the opposite cure. So lower back issues also causes medial knee pain. Then in this position you can bend the foot. Okay, then we'll do it on this side again. Bend the foot, and now you can bend the knee. Now in this position you can work into the anterior tib. But remember, when you're working on the skin, I find it's always better to work with a little towel, because then you get nice and deep in. You can feel that way. Yeah. Better, much better. But obviously, for the sake of the video, I'm going to take away the towel just so that you can see where I'm working. So if the shin bone is here, this muscle is to the outside of the shin bone, and you can go from the shin bone and kind of go across. You feel that way? Mm-hmm. Not too sore though, hey? No. Okay, good. And then from the outside in towards the shin bone, that's a bit more tender? Yeah. Yeah, I can feel that. But you don't have to feel. At the age of 9, I find they're a lot better at telling you what's happening. Even though it's ticklish, they'll tell you. And sometimes a bit of tenderness, they can start handling tenderness better than ticklishness. And this is the exact fact for adults. Adults prefer pain to ticklishness. Now, ticklishness is a protection response. So if it's ticklish, you know you have to go there. So you've got to figure out a way of going there. If you can't get in there, so if that's very ticklish, then what you do is you go a few times, hit that spot a few times, so it's not too much. Then in this position, you can also do the calves. So just up and down, side to side. As you can see, it's very tender. That's why it's more ticklish. So then lift the leg up. In that position, let him relax, and then you hold on to the muscle, ask him to move the foot. Just move the foot point. Fantastic. And there, move it again. A little bit tender, not too sore. Good. Move it now. Feels good? Mm-hmm. Good. See, so it's tender, but they actually prefer that to ticklish. So the faster movements is a good way to get in, but with the ticklishness, you've got to watch it. You can't go too long. So a little bit, and then relax. A little bit, and then relax, and then hold it and let him work it. Same with the calves. So in this position, you can also get hold of a spot. So while you're pushing, so again, I'll use the towel. Just keep your knee like that way. I'll use the towel, and then I'll work it like that. That's quite tender. Work it like that, then I'll grip it and work the foot, and relax. Very good, hey? So again, it's just you in the muscle, and you work it on that same spot, and then you work it. So there's two things. You work it, and then he works it while you're gripping it. Fantastic. With the foot, you want to come in here. I like to add a lot of movement in the foot. So whatever you do, as long as they're comfortable, it's very good to add movement. It's also nice to add some movement in these bones here, but you don't want to push too hard. It's literally just working at a bit, playing around with it. It's nothing too much, not too hard pressure. And there's always some nice trigger points right in the arch there. But what I like to do is to kind of work the foot while pushing. So it's not hard. It's not too hard, boy? No. Quite nice actually, eh? Mm-hmm. So just in there. And then another good place, with their age now, you can go a little bit more into here. So again, I'll use the cloth right over here, and right over by the ankle there's like a ligament that runs across, or a ligament, or fascia, a fascial band that runs across here, holding those, kind of hold those muscles and tendons in place. And I find that fascia often can get hooked onto the muscle. So what's good to do is grip it and just work the, not too sore boy, grip it there, in with 2 fingers, and then work it as you're gripping. Probably about 10-15% pressure. It's not too hard. And just work it like that. It's very good. And if you feel that's a bit tender, yeah, then what you do is you kind of just stop on it, work a little bit, and then get him to work again. That's a great way to release the ankle. Bend the knee for that. Okay, great. Now you're going to go into that psoas, which is a very sensitive ticklish area. So what I like to do, if it's very ticklish, to go in. If you go straight in there, it's too ticklish. So what you do is you hold your hand on the knee, hold the hand on the stomach, just let him relax with it on there, and then you slowly kind of edging your way onto this little bone there. Now I'm feeling the pelvis bone. As soon as I'm on that bone, it's very sensitive, eh? You can feel that, but it's not sore. No. It's ticklish. It's actually sore, but it's ticklish because that's what their brain tells them. Ticklishness is a protection, so it'll say go away, go away. So just gentle on that, and then 2 fingers or 1.5 fingers off that, and you just gently hold it there. Relax again. Good. So slow movements. Now in that position, you ask him to lift the knee to the chest. Just lift the knee to the chest and relax down, back to the foot on there. Good. And then once you've done that once, you can slowly wiggle it a little bit, as much as he lets you. Lift the knee again and relax. And then last time, just about 2 or 3 times like that. Now take it all the way down for that. All the way down. All the way down. Very good. And that's how you stretch and stimulate that psoas. Great. So there we've gone through the quad adductor, anterior tib, calf, bit of foot, a bit of the ankle, and the psoas, which is very important. Now, psoas is a difficult muscle to actually release because it's very deep in. So that stimulation and that fascial stretch that you do with him relaxing the leg down is great to do. And you want to get as deep as you can without pushing hard. So you're working your way in. So you just flat hand there. These two fingers are slightly pointing in. Hold it there for a second, not too sore. Fantastic. Then you slowly go more, not too sore. Once you relax, it's the movement that's it makes the body a bit skittish. Now lift the legs straight for that. Straight up and relax. Good. And then as they relax, you can go a little bit deeper. The body will allow it. Up and relax. And you should start feeling that muscle just pushing onto your fingers. And relax. And just do 3 or 4 of them. That'll be great to stimulate that psoas. Rather do it 5 or 6 times throughout the day if that's what you want to do. Or, every day a little bit. So 5 to 10 minutes a day of releasing will be great for them. One thing we didn't do is the hamstrings, so bend up for that. So in this way, I'm going to again show you on this leg. I would normally stand on the same side. So you lift this up, and now because they're relatively small enough for you to get in, then you can grab hold of this. You see it's ticklish, the quick movement. But do a bit of that quick movement, just 2 or 3. Do 2 or 3, relax, do 2 or 3. So right in there. Okay, sorry boy. There. Okay, now you get them to straighten the leg up. Straighten the leg and relax. Good. And you're just guiding with the arm. Straighten the leg. Good. And relax. And there. And relax. Good. And you have a nice solid grip. Not too hard. So a little bit of a wiggle. And that's going to be very ticklish. So just 2 or 3 wiggles and then you hold it. And then you ask them to lift. And I like to just guide them. So I'm not pushing the leg up. They're doing the straightening of the leg. But you're just guiding them so that it doesn't collapse. You don't want them just to drop down. Because they don't always do exactly what you want them to do. So guiding them, it's a great way to do it. Fantastic. So that's a 9-year-old and up. That's a great way of doing a little release of the legs. Psoas, quads, hamstrings, adductors, anterior tib, calf, and foot. Well, I hope that works for you, and thanks for watching.